My name is Dr. Curtis Gable. I'm an otolaryngologist, which means ear, nose, and throat surgeon, as well as a facial plastic surgeon. I've been doing that for over 20 years, and I work with Inspire Smiles. Why am I at a dental office? Well, I'd like to tell you a surprising fact about your mouth. It's connected to your nose and your throat and your ears. How is it connected to your nose? Have you ever thought about the fact that your top of your mouth is actually the bottom of your nose? Our teeth find each other when they come together, so it's required that our mouth is shut as we're developing. When we're at rest as we're developing, our tongue needs to be in the roof of our mouth, and that's what allows our palate to expand to the correct size so all our teeth can fit in there, but also that expands our nasal airway. And if we're mouth breathing, our tongue is not sitting up in the palate, so what happens is our palate never expands to the correct size, and because it's not interdigitating with the teeth below, that's not the right size either. Our nose is now smaller because that's the roof of our mouth is the bottom of our nose. What winds up happening is we have chronic stuffiness of our nose, so we're mouth breathing more. All of our teeth can't fit into our jaws, so we have crooked teeth that are misaligned, and we have sleep apnea because our tongue can't fit into our mouth. We get cavities because we're walking around mouth breathing all the time, and discolored teeth because of the malocclusion that happened because our teeth never interdigitated with each other and didn't develop properly. Now we're grinding our teeth because our body doesn't like that. It wants to find the right occlusion, and it's causing temporomandibular joint discomfort. So it's really important to have, as you can see, nasal breathing, especially as we're growing up. But sometimes, adults have this problem too, especially if they grew up mouth breathing a lot. And so at Inspire Smiles, we can properly evaluate that and come to a lasting solution that's properly diagnosed. The inability to breathe through the nose is something that really impacts people's quality of life. It's very uncomfortable for most people. Interestingly enough, if someone's spent their entire life not being able to breathe through, let's say, one side of their nose, they actually may not even be aware of it because that's just how it's always been. But it is impacting them regardless of whether they can feel it or not. It's probably disrupting their sleep and disrupting the quality of their life. Of course, there may be other things going on with that too, with the sinuses and things like that, but definitely there's a connection between our mouth breathing and our dental condition. People who have airway issues, of course there may be a variety of different reasons why people have airway issues, specifically with some of the things that arise from having chronic nasal dyspnea and the related dental problems from that. You can get into a vicious cycle. You're tired all the time, so you start to gain weight. Of course, weight gain is associated with sleep apnea too, in addition to the issues with the mouth and tongue. And so lack of focus and things of that nature can arise. Well, I'm a surgeon. I'm also an athlete. And for me, performance is really important and focus is really important. And I'm sure it is for a lot of people watching this right now. You want to be performing at your best. If you feel like you're tired all the time, can't focus, mouth breathing, dry mouth, someone needs to properly evaluate that, and you can have the opportunity and access to correct that and improve your quality of life and have that focus and performance that you desire. There's a variety of different reasons why someone might have trouble breathing through their nose. Most people, I think, have heard of a crooked septum called a deviated septum. That is one reason. Frequently, there's other reasons as well. There's some structures up inside the nose called turbinates, for example, that could be too large. Sometimes there's anatomical variations of other structures inside the nose and sinuses that can lead to nasal obstruction, or the shape of the nose itself. And then there's things back further on our nose, like our adenoids, that can also obstruct the airway. And sometimes it's a constellation of all those things. So you need to be evaluated by someone who has expertise in all those areas. As a otolaryngologist, as well as a facial plastic surgeon, I'm an expert at evaluating all of that and making an accurate diagnosis and rendering the treatment. Sometimes the treatment for these conditions is as simple as a non-medicinal solution, some type of a non-medicinal nasal spray, for example, perhaps, or avoiding something that you're allergic to. It could be as simple as that. Sometimes it is a medicine, or sometimes it's a procedure, and of course then it depends on what it is. There's a variety of different procedures, and of course if you get properly evaluated, we would be able to tell you exactly what that would be. Well, I think if in the past you've been evaluated and the issue isn't resolved, it's time to get a second opinion and have another set of eyes, expert eyes, look at that and advocate for yourself until you can be comfortable that you've been given an accurate diagnosis and a treatment plan that works. Amazing things about Inspire Smile is that our dentist, Dr. Ilona, is not just a single tooth dentist. She does, of course, treat single teeth, but she also treats the entire system and is able to appreciate and analyze the entire system of the mouth and its surrounding structures and treat that comprehensively. And likewise, I am an otolaryngologist, head and neck surgeon, so I have an expertise in airway problems, but I'm also a facial plastic surgeon. And so I have expertise in analyzing and changing the shape of, for example, the superstructure of the nose itself as an example. So the synergy between us is what sets Inspire Smiles apart and allows us to be able to comprehensively analyze and treat people that may have been told at other places that either nothing is wrong or it just wasn't properly evaluated and the entire system wasn't evaluated comprehensively to allow for a solution to be generated. If you think you have any of these issues, we'd love to see you, meet with you, connect with you, and take a look and see what's possible here at Inspire Smiles. You can go on our website or call us and schedule an appointment. Let's connect.